Okay, I'm Nora. I'm 28 years old. I'm working at Thembalethu Home-Based Care as a visitor coordinator. What I can say that Thembalethu it's like a home-based care. We also have, and Thembalethu also gave birth to Youth in Action. Youth in Action is like a group of young people who are like involved in different activities. So through those activities, we're trying like to preach the gospel of abstinence. It's like we're giving the young people something to do so that they won't think a lot about sexual activities. So we feel like if we can engage them to sports, then they will spend most of their time like in sports than to go around looking for boyfriends or girlfriends so that they will end up in bed. What I do daily is I visit clients at their houses, sick patient at their houses, and then also I do HIV education around schools, clubs, and churches. And then after that, I do conduct mobile testing. Like if out, after the education, if there are people who want to test, then I organize a day and go back to their village to do a mobile testing. And then also after people have been tested positive, I do take them to clinics for CD4 count tests and also take them for adherence classes. And then also after that, we do like support them with counseling, like after they start ARVs. Because really it is important for people to understand that they need to take ARVs for the rest of their lives. And then also you don't just stop the medication if you feel like you are sick or if you feel better. So even after they're on ARVs, we do go back to them and give them counseling. She says Thembalethu helped her a lot because she after finding out about her status, then she was supposed to go to clinics and hospital. So she didn't have money for transport, and then Thembalethu provided her with transport. Always, whenever she wants to go to clinic or hospital, Thembalethu car picks her up, and then take her back also. And then also, she's receiving like care from Hannes. Yeah. So he comes to give her medication like Panado, like anti-diarrhea tablets, anti-vomiting tablets, and then also medication for her sores around the body. And then also she is receiving a power meal from Thembalethu. Power meal, it's like a soft porridge. Yeah. So she's also getting that at Thembalethu. She thinks she will be dead by now because by the time she was really, really sick, she couldn't even stand up. So because Thembalethu provided her with transport, then she managed to get to the clinics to get medication so that she can feel better. She will have been dead by now if it wasn't for Thembalethu. She says she's Nobile, she's 21 years old, and then the baby is Nhlanhla, and then he's 2 years old. So like Thembalethu is helping her with transport to go to clinics and hospital, and then also they are bringing her food, and then also food for the kid, like yogurt and juice.
And then Pilanjani Thembalethu.
She says she's living, and she's now living because of Thembalethu. So she thinks without Thembalethu it will be difficult. Okay, she says she was staying in Block B with her aunt. After both parents died, she stayed in Block B with an aunt. And then when she started getting sick, then the aunt chased her away because she said she didn't want like people who are sick at her house. And then they came back here. This is their parents' stand. So they came back here and then they asked some people to help them build this little shake. And then when they came here, one care worker came in to visit them. Then when she came in, like she explained to them that she's working with Thembalethu home-based care, and then there's a guy called Hannes. Hannes, he does home-based care work. He always goes to the houses of sick patients to visit them. And then when the care worker told them about Hannes, they wanted Hannes to come in and help. That's when Hannes came the first day. He like seen the situation of them, and then he decided to take them to clinics. That's when Hennis asked for the Thembalethu visiting car, to come and pick them up, because she was really sick then. She couldn't like walk to the clinic because the clinic is really far away. And then the visiting car came in to pick them up to go to the clinic and take 34 count blood. So like when you are HIV positive, you have to go to the clinics and take the 34 count blood so that you can see how your immune system is like. So then Hennis used always to come to see them, because by then she was really sick. And then Hennis also helps people with like the anti-diarrhea tablets, anti-vomiting tablets, pain tablets. So he does give it to them. So Hennis was really helping with all of that. And then also the visiting car was helping to take them to the clinics and hospitals. And then they found that she has TB. And then they said they have to give her TB medication first for 2 months. After that, they can put her to ARVs, because they can't put her to ARVs if there's a TB aside. So then she started taking the TB medication, and then she started 1 month back from now, and then her sister is going to pick her TB medication. So after 2 months, then she can go back to hospital and get her ARVs. So another thing that Hennis is helping her with is food. He buys food for them like every month or whenever they need it. So she says Thembalethu really helped them a lot, because without Thembalethu they wouldn't have food, and then it would be difficult for them to attend the classes and to go for doctor's appointments at clinics and hospitals.